Hi there, it's Professor Karol Sikora. I'm Professor of Medicine at the University of Buckingham, founding Dean of the medical school there. I'm also an oncologist and have been a consultant oncologist in our National Health Service for over 40 years, lastly at Imperial College. So I'm going to answer a few questions for people in Serbia. First of all, when do I think the coronavirus pandemic will end? It's burning out all over Europe. If you look at the figures, the new cases per day, it's dropping. The hospitalizations have dropped right down here and across Europe. And thankfully, the deaths are coming right down. There are still problems, there are still little pockets of infection, but they will gradually die down, probably by the end of next month, the end of June. And then we'll forget about it, just like we've forgotten about SARS and MERS and the other previous coronaviruses. How will it disappear? You know, it disappears. Any pandemic disappears when we say it's gone. We have to learn to live with this virus. We've learned to live with SARS, so what's different about this? It has been frightening. People have died. But when you look at it all, at the end of the year, the total number of deaths due to this virus compared to the total number of people that will have died during this year in any case will not be too far off. It won't be as bad. And of course, different countries have been affected in different ways. We've had it bad. We don't understand why in Britain. You've had it in Serbia very light. I mean, I've got the figures here. 250,000 cases, 250,000 cases here in the UK and 36,000 deaths so far. Probably means we're going up to about 50,000 deaths by the end of it. Whereas in Serbia, 237 deaths. Totally different. Okay, you're a tenth of our population there, 7 million people, as opposed to 70 million people nearly in Britain. But that is pretty dramatic to have such a low death rate. You've done well. What do you advise people about doing things? Social distancing is all we can do. We're in a sort of dance with the virus. We socially distance, the virus can't infect more people, and it gradually dies out. The virus is also weakening, and we don't understand why. And of course, immunity is coming, herd immunity, when more and more people have been infected, making antibodies, using other arms of the immune defense mechanism to protect them against the virus. The next question is about second waves. Will there be a second wave? The answer is we just don't know. So the WHO prediction is that there will be a second wave this autumn, September time, and we'll have to all go into lockdown again. I don't think that's likely. I think that's, it's not happened in the 4 countries that came out of lockdown in April, Czech Republic, Austria, Denmark, and Norway. There's been no second wave. Schools are up and running, restaurants are open, bars are open, all with some social distancing, but it's really not too bad. If there is a second wave, it would be a disaster both for the economy and for healthcare systems, and for patients that use healthcare systems with other diseases, such as cancer, heart disease, psychiatric illness. Which COVID control mechanisms are best? It's an interesting question. Social distancing and washing hands are the 2 things that really affect the spread of the virus. Wearing masks, probably very little, and a vaccine, if it comes, when it comes, it'll probably be too late. I really hope it comes too late, because I want this to be over by the summer so we can go on holiday and things like that. Can collective immunity be achieved? It can. It's the wisdom of epidemiology is that you have to have 60% of the population to have the virus or have been infected before you get what's called herd immunity. It comes from studies in animals with animal diseases. When you have a flock of sheep or cows and you're trying to get the whole herd, you just need to get 50% and that's it. It can be achieved, and people argue about how far we've got. Some epidemiologists think we may already be nearly there. How many people do you think will die? I think we've done that. Did the WHO make mistakes? Everybody makes mistakes. We couldn't have predicted the severity of this. The first mistake was to allow China to let people travel out of Wuhan when it was clear the epidemic, the localized pandemic, took place in Wuhan for a virus from the laboratory. That would be enough time right at the beginning to close down all international travel, all trains, boats, planes out of Wuhan, to stop travel, to stop the virus spreading. Instead, it went on the air routes of the world and just spread around. It traveled first class. It went on the cruise ships of the world. Again, luxury cruise ships. It danced through the night with the passengers in the back of their noses and in their throats, and survived on doorknobs all around the luxury resort hotels of the world. This was in probably January of this year. And it created such destruction. How did Britain become one of the most infected countries? You know, we just don't know. And when this is all over, by the end of summer, we'll be able to look at the epidemiology, comparing different countries, the time of lockdown, the time and method of coming out of lockdown, the precautions taken, quarantine arrangements and so on, and the strictness of lockdown. Here, it's been a very gentle process. Sure, the police are entitled to even arrest you or certainly fine you if you break the conditions, but they've been very gentle. It's a very British type of lockdown here. Other countries, especially those with a more military police state background in Latin America, have been quite ruthless with the population, of keeping them essentially locked up unless they have a valid reason to leave the house. What about the deaths in Britain? We don't really understand why the British death rate is high, as in Belgium, for example. The death rate in Serbia is just fantastically low, and in fact all those countries. Could it be the weather? Could it be the fact that spring came quicker to those countries than to Northern Europe? It may be. That may be another factor in the dance of the virus with us, that the virus is weaker because its routes of transmission in a warm environment, on tables, on benches and parks and so on, is not as strong. And I think the only thing, the last question is, what can you do to protect yourself? As I say, avoid crowds. That's the obvious thing. Get out and about. The weather's great at the moment. Just get out and about. Avoid crowds. Try and keep social distancing. By all means, see your family. By all means, go and see your grandchildren. The only exception to that would be people that are vulnerable, that are elderly and have lung infections and heart disease. Maybe they should be a bit more cautious and not travel too much, but certainly go and sit in the gardens, go for a walk out on the streets, but just keep away from people. The mask wearing, who knows? There's not much data either way. And then testing with antibody. No one really knows what a positive antibody test means in terms of immunity. And the concept that it would give you an immunity passport is really not a valid one. And it's been stated so by the WHO. And it can't really be used for international travel, which is one of the aims that it was suggested for. So we are getting out of this. We're getting out of it together as one Europe. North America's getting out of it. Asia got out of it early because they were infected earlier on in their natural history, and we're getting there. So it's all positive, and good luck to everybody in Serbia. We're all in this same war against the virus together. We've got to do better next time. That's clearly, we need to get the WHO to strengthen its guidelines for getting us out of these situations in the future. Thank you for listening.